But
Mm.
for some babies, it's paramount that they are detected as early as possible to try and keep them as healthy as we can in that period where somebody has a suspicion that something actually is really quite seriously wrong and baby is deteriorating, and we want that baby in a hospital setting as quickly as possible so we can make some plans and get a diagnosis made and get the baby over to a cardiology centre as soon as possible.
And I guess in those cases, that essentially just then means that baby's much more likely to have a better longer term outcome the earlier they're spotted.
Definitely, definitely. So if we can get babies diagnosed early or timely, or before we do get them into a situation where it's an emergency situation, that's what we'd like to prevent more than anything, is that if we get babies in that time, then they're much healthier and much more clinically well going into an operation, rather than babies where it's not picked up, it's suddenly going to be a problem, and babies are kind of getting sicker and sicker and sicker. And some of our babies, particularly when they have a heart condition that's a duct dependent lesion, that's a really real an emergency. We want these babies picked up and sent over as quickly as possible to try and keep them well, but also that if you are a baby that is seriously ill, your risk when you have your operation is higher because you're much sicker going into your operation. And sometimes we're in a situation where we have to just do an operation because it's the only thing that we can do to try and help the baby. Sometimes we're in a situation where babies aren't well, they're in an intensive care unit, they might be ventilated, might have lots of lines and tubes in keeping them alive, but we might need to wait a little bit because they're almost too sick for an operation, and we need to wait for them to get a little bit better before we can send them in for an operation.